DocTalk is brought to you by Merck Animal Health, the science of healthier animals.
Hey folks, welcome to DocTalk. We're going to have a great show. Dr. Emily Reppert from Kansas State University is here today, and we're going to talk about something that a lot of people deal with in their cow herds, and that's the old cancer eye, or the squamous cell carcinoma. We're going to talk about different things as far as predisposing factors, what to look for in clinical signs, how to treat them, and much more. Thanks for watching DocTalk, and stay tuned for the show.
As dependable as the sunrise, in dairy parlors, open pastures, on ranches and feed yards across America. A place where reputation is more than a name, where the science of healthier animals is a way of life. It's the responsibility that drives who we are and what we do. Every decision, every day. It's your livelihood and our responsibility.
Closed caption brought to you by AgriLabs, the perfect pairing of performance and value.
This segment brought to you by the new Hired Hand Portable Cow Sprayer. For more information, visit cowsprayer.com.
Hey folks, welcome to DocTalk. Dr. Reppert, welcome to DocTalk.
Thank you. Nice to be here.
Yeah, it's a pleasure to have Dr. Emily Reppert here. She's a veterinarian. She's boarded in internal medicine. She's an assistant professor here in the Livestock Services Department, where she serves as an internist and does a lot of specialty cases of referrals, probably even some primary care that's
Absolutely,
brought in,
yep.
and many different types of cases with cattle, food and fiber type animals. And today we're going to talk about something that we've seen a lot of within our industry, but always take time to kind of come back and let's get everybody squared away on what cancer eye is.
Sounds good. Yeah. So when we're talking about cancer eye, we're talking about tumors that are associated with the eye, and the type of cancer that we're talking about is squamous cell carcinoma. So something we see in humans, horses, variety of other species.
Yeah, skin cancer, a lot of squamous cells that people get, too much sun, things of that nature. You go get them burn off and that. So you know, they why the eye? Why? I mean, is there a reason why the eye is?
Yeah, so I think that, you know, when we look at predisposing factors, or why is that the location that they tend to form. So things that, you know, are associated with cancer eye are any of the lightly or no pigment areas on the body. And so one of the more common places in cattle is going to be around the eye. And so that, in combination with being in an environment where they're exposed to a lot of light, so environment of a lot of sunshine is a predisposing factor as well. So
outside grazing,
yep, that sort of thing. So we typically, it's more commonly seen in our light-faced breeds, or, you know, black baldies that
Herefords.
don't have, Herefords. Those are kind of the poster child for cancer eye to develop. And beyond that, I think we don't really know why.
Yeah. Well, it would make some sense, you know, that you got light-faced cattle and as they're grazing, it's no different than flies attract in pink eye and
Sure.
some of those types of things as well, irritants. But, you know, outside of genetics, you know, are there other environmental conditions outside of sunlight?
Yeah, I think sunlight's the big one, really. Just exposure to sun, and that's kind of our primary problem.
So when we look at cattle within, you know, obviously, has anybody done research to see if there are some of the Herefords that are lines that are more predisposed than, or is it, I mean, because, you know, not all white-faced cattle get it.
Right. Not to my knowledge. You know, I think there are definitely certain families, but I don't know of a specific study that has looked specifically at that.
And I know that when I was in practice, we would see some herds of cattle that would constantly be bringing us animals in the summertime versus some of the herds that we wouldn't, of the same breed type, that we wouldn't see any.
Yeah, and I don't know that we know the exact gene that's associated with it, but you're absolutely right. There definitely is familial trends. Yeah.
In the future.
Absolutely.
Well, we're going to take a break. It's a great start to Cancer Eye with Dr. Emily Reppert here from Kansas State University. When we come back, we're going to talk about some of the things that you can look for in clinical signs with cancer eye in cows.
This Meet the Future Veterinarian is brought to you by Zuprevo. Choose confidence. Choose Zuprevo for BRD treatment. Julia Herman took a winding path to become a veterinarian, with inspiration as a child from National Geographic books, then with a bachelor's in zoology and a master's in epidemiology. After graduation from Colorado State's College of Veterinary Medicine, Julia plans on finding a position that combines livestock and wildlife medicine, epidemiology, research, and public health.
Some call it a come-from-behind victory, an unlikely win, a reversal of fortune, snatching victory from the jaws of defeat. This is our moment, our victory dance, because we choose confidence. We choose Zuprevo for BRD treatment. Ask your veterinarian to prescribe Zuprevo. Zuprevo is a fast-acting, long-lasting BRD treatment that you can count on to get the job done. Choose confidence. Choose Zuprevo from Merck Animal Health.
Still using ineffective fly tags on your cattle? It's time to eliminate fleas, ticks, flies, lice, and parasites, and at the same time, give them a shiny coat, making them more valuable. One fly tag can cost $2.50, but you can do this all for about a nickel a head. Introducing the Cow Sprayer, designed and built in the U.S. The Cow Sprayer is portable, solar-powered, and comes with a 25 or 40-gallon tank. Eliminate parasites for about 5 cents a head with the Cow Sprayer. Cowsprayer.com.
Do your cattle struggle with pink eye, BRD, or another disease? Contact Newport Laboratories for a customized solution. Our custom-made vaccines are produced using the specific diseases found in your area. These USDA licensed vaccines offer potential cost savings on vaccine and labor. Contact your veterinarian or Newport Laboratories the next time your cattle are in need of a custom solution. Newport Laboratories custom-made vaccine, because every situation is different.
This segment brought to you by the new Hired Hand Portable Cow Sprayer. For more information, visit cowsprayer.com.
Hey folks, welcome back to DocTalk. I'm Dr. Dan Thompson here with Dr. Emily Reppert, where she is a boarded internal medicine specialist here for cattle, food and fiber animals at Kansas State University's Veterinary Health Center. You can refer cases to Dr. Reppert, your veterinarian, work through your veterinarian. And if you're in the area, we see primary care. So bring them on in, and we'll take care of your cattle and others. But Dr. Reppert, talking about cancer eye, what are some of the things that a producer needs to be looking for? What are between early, full-blown, different stages of it?
Sure. So I think the most important thing, like a lot of different types of cancer, this typically is a disease that we see in older animals. So again, the ones that have had more exposure to sun, more time for the cancer to develop over time. So typically this is something we see in our older population of animals. So that would be the ones that I would be wanting to pay particular attention to. I think the other thing is, just like any type of cancer, there's progression of the disease. So in the early stages of the disease, maybe before it becomes really invasive, things to look for, the places on the eye that the cancer really likes to go is at the junction between kind of the dark part of the eye and the white part of the eye. That's one place. Okay. The other place is the actual eyelids themselves. And then the other place is the medial portion, or the part towards the nose of the eye. They have actually an extra, or what they call a third eyelid. That's another place that they can get a lesion. And the early lesions tend to be sort of flat, almost plaques, and they're usually very pale. Those lesions are easier to treat than the ones that are kind of more malignant or more troublesome. The ones that are more invasive and can be more difficult to treat are the ones that are larger, more prolific, really pink, and even portions of them can start to die and have sort of a foul smell to them. So certainly, if there's any sort of plaque or spot on the eye, and especially if the eye is starting to water or it's bothering the animal, that would be one that I would want to take a closer look at for sure.
And it's probably something too that is if you have a breed that's susceptible or white pigmented faces, that's something you could probably do a quick scan when you have them in the chute, whether it's for preg check or for branding and pre-breeding shots, that we can just have a quick look and because can't these animals, if we catch it early enough, can't they stay fairly productive on our farms? Yeah,
so especially if we get them in that sort of pre-cancerous lesion before it's a huge mass that's kind of hanging off of the eye, those smaller ones can be treated and they often will go on to be okay. But it's the ones where they are getting big and are involving other parts of the face that are really problematic. So yeah, absolutely.
So just make sure that you're looking 3 areas of the eye, looking at the junction of the coloration and the white sclera, the eyelids, and then that third eyelid are going to be the 3 areas for cancer eye. Get it caught soon, get it treated early, cow has an opportunity to stay in production. When we come back, we're going to talk a little bit more about cancer eye, some of the treatments, some of the outcomes, prognosis of these cases with Dr. Emily Reppert from Kansas State University.
The BQA Tip of the Day, sponsored by Beringer Engelheim Vetmedica, Inc.
This is Shane Terrell with Production Animal Consultation, here with today's BQA Tip of the Day. Today we're going to talk about proper organization or good organization of the work area, primarily for employee safety or the safety of those people working in this area and for efficiency of processing. The first example, is, as you can see, this yard is using multiple clips, magnetic clips and hooks, so we can organize products in a manner in which they can be used systematically, so they're administered to the proper area and we're applying those products with proper spacing. Other examples would be hanging cords or dropped cords that allows for less opportunities for processors to trip. Other examples would be having tags laid out in an orderly manner to speed up the efficiency of processing. Any record keeping that needs to be done, having a space available so that can be done in an efficient manner.
Say this is a calf that's been run through the chute a few too many times. Going through the chute stresses cattle, causing them not to eat like they should. Luckily, Pyramid 5 plus Presponse SQ provides proven protection against key respiratory diseases in a single shot, with just 1 trip through the chute. Talk to your veterinarian about Pyramid 5 plus Presponse SQ, and soon your calves will relax and eat like a whole different animal.
Valley Vet Supply is devoted to providing information and professional quality products at reasonable prices.
Valley Vet Supply.
This segment is brought to you by the Beef Quality Assurance Program and the Kansas Beef Council, improving animal care and beef safety for more than 20 years.
Hey folks, welcome back to DocTalk. Dr. Dan Thompson and Dr. Emily Reppert. We're from Kansas State University. Thank you for joining us. We're having a great discussion with Dr. Reppert on cancer eye. She serves as an internal medicine specialist here in our veterinary health center in the livestock services department, teaching students, seeing cases, teaching classes, doing a lot of different things, don't you?
Yep, run the gamut.
We're very lucky to have her here on faculty. Emily, when we talk about treating these animals, what are some of the different ways that we can treat them, or if someone brings an animal into you, what are some of the things that we're going to do here at K-State?
So the first thing that we try to determine is, is it one of the more smaller kind of precancerous lesions, or is it a large mass that's going to be needing to be removed? So the smaller precancerous lesions, so those are going to be those small plaques of abnormal tissue. Those can be treated relatively easily with a variety of different therapies, and One is basically just freezing them off, so using what they call cryotherapy, so applying cold to the mass, allowing it to thaw and kind of applying cold again. There's also some laser therapy that can be used to kind of thermal almost, so we can use extremes of temperature, either extreme hot or extreme cold.
Freeze it off or
burn it off. Yep. The trouble comes when we have some of those larger, what we call malignant types of tumors, because not only can they involve large portions of the eye, but they can actually involve local lymph nodes associated with the head, and that's when you get into real problems. But with some of those larger lesions, we can actually excise a portion of just the affected tissue. But unfortunately, a lot of times we don't catch them until other structures are involved, and so sometimes the entire eye actually has to be removed.
And when you know the inoculation of those, though, those cows you can remove the eye and the cow will get along okay.
Yeah, and I would say that, my only caution there is that, even if we have to remove the eye, we want to make sure that we're removing the eye before we have involvement of the bone associated with the eye. If the bone's involved, even taking the eye out is not going to solve the problem. But if we just have, kind of severe eyelid involvement or something like that, and the mass is too big to be taken out just itself, but we have to take the whole eye out, oftentimes those animals will do okay.
Yep. Other things as far as treatment, what are some of the things that when people take those animals home, do they need to do? Is there anything to cover the eye or things to that nature?
So certainly, at least in the immediate time after, we've done cryotherapy or removed a small mass, kind of keeping them in a protected environment, either putting a patch on just for a small period of time so they don't have direct sunlight on the eye. Certainly fly control if it's that time of the year where flies might be wanting to irritate the area. And then finally, I think the most important thing is that a certain percentage of those masses that are frozen off or burned off will come back. So the recurrence rate is anywhere between 30 to 40%. And so if you have an animal that has cancer eye, it would just be prudent to continue to keep an eye on it so that, we can freeze them off as they come back if that happens.
Absolutely. All right, folks, great information and understanding of cancer eye. You can see why we're lucky to have Dr. Reppert here on our faculty at K-State. When we come back, we're going to talk about some of those case outcomes and things to think about when dealing with animals that have cancer eye in your cow herd.
When looking at the number of farm and ranch operations, the USDA Census of Agriculture says cattle and beef production is the largest single segment of American agriculture. The census also says the average age of the American cattle farmer or rancher is in the late 50s. In order to support the continuous supply of U.S. beef, these producers need to do some business planning to successfully transfer their cattle operations to younger, independent producers.
I'm Andy Biergo. I'm owner of Biergo Angus Farms with two of my sons, Bryson and Drew. We've been in business since 1950, and a family farm's been around for 145 years. And we've, like everybody, we've been through some good times and bad times, and doing well and having things that protect you and go forward. The beef checkoff could be one of the things that makes us global. We go to protect ourselves and protect our trading ability, and one way or another, we're going to have people that will protect us and do that. I've always had this theory that you're either doing things to advance and do better. I've never been a believer in this, it'll be normal or average. I'm a firm believer that we'll be going one way or the other. And without protection and advertisement and teaching people to believe in what we produce, it's more about producing the consumer. That's our client than maybe it is proving it to ourselves.
For me, one of the most important aspects that the beef checkoff provides is sustainability for future generations. My brother and I both have daughters, that we can see a future in the life that our grandfather has lived, that our father has lived, and now that we are getting to be a part of, and also the opportunities out there for our daughters now.
It was my dream when I was a little boy to own the home 80 acres, and I've always told my sons that You either need a job well enough you can have hobbies or do what you want, or you need to have a passion for your job and what you do. And I've had a passion for cattle my whole life, and my sons have a true passion for it, and I'm very proud of how they handle the farms.
The Beef Checkoffs has given us a lot of different opportunities for our daughters to have a chance to come back and be a part of this in the future.
If my calves start healthy and stay healthy, I've got a good shot at making money. That is why I trust Clostrix. It gives my calves the protection they need until their own immune systems kick in.
Calf raisers trust Clostrix colostrum supplements. Clostrix is USDA licensed and proven effective. When your money is on the line, trust Clostrix.
Broadband has become as important to us as highways. That is why DocTalk is teaming up with NTCA, the Rural Broadband Association, and rural broadband companies like Blue Valley Telecommunications in fighting for quality broadband access through the program Smart Rural Communities.
I don't think we have any idea what's coming in the future. I couldn't have imagined 5 years ago what we're doing today. So in 2 years, I would guess there's things we can't imagine that we're going to be doing.
To learn more, visit ntca.org/smart or bluevalley.net.
It's easy to spot the man who uses Synanthic. With lower volume and less waste, Synanthic steps up your deworming routine. Get more deworming with less dewormer at Synanthic.com.
Beringer Ingelheim Vetmedica Inc. knows the importance of beef quality assurance and asks you to step up and get certified. Go to bqa.org for details.
This segment is brought to you by the Beef Quality Assurance Program and the Kansas Beef Council, improving animal care and beef safety for more than 20 years.
Hey folks, welcome back to DocTalk. Dr. Dan Thompson and Dr. Emily Reppert. We're from Kansas State University's College of Veterinary Medicine, where Dr. Reppert is an assistant professor in the Department of Clinical Sciences and is also a boarded internal medicine specialist for our livestock services in the Veterinary Health Center. We're talking about cancer eye. There's been some great information talking about what to look for, what causes it, and how we're going to treat it. And so now let's get into some of that. Some of the case outcomes or things that producers need to be thinking about if they do heal or maybe more importantly, if they don't heal.
Sure. So I think from a production standpoint, this is one of those diseases that can be pretty costly, and that can either come in the cost of having to continually treat the lesions or the cost of the animal itself. Reason being, at least there's been a recent study that looked at reasons for condemnation of carcasses at slaughter, and just over 12% of carcasses were condemned because of cancer eye lesions. So I think that's an important thing for producers to recognize, that if you got cancer eye in your herd, you want to catch it early so that you don't end up shipping something that's going to get pulled off the line. Yep.
Yeah, you don't. You know, folks, if you see something on the surface of the eye, you don't know lymph node involvement.
Yep.
And things of that nature, and so. We really recommend from the beef quality assurance side of things, let's not send those cancer eye cows to slaughter or through market channels.
Yeah, yep. So, some people recommend culling those animals just because they don't want to deal with, having to repeatedly treat those or have a carcass that's going to get condemned. Other things that we recommend as far as prevention strategies would be obviously breeding for those animals that in our white face breeds that have some pigment around the eye. That's been shown to be decrease the incidence of squamous cell carcinoma. But short of that, just being vigilant about seeing any of those early indicators of disease, because again, catching it early is when we're really going to be most effective.
What about fly control and just irritants and things to that nature? Obviously, I would think that if the squamous cell from the sunlight, obviously if we have more irritation and things of that nature, probably need to stay on top of.
Sure, I think fly control and pink eye and all of that's really important. What role that plays directly with the development of cancer, I think we don't know, but certainly anything that's going to irritate the eye, could be.
I really think too, we got to get back to, if you have a herd that has a high prevalence of squamous cell carcinoma in the eyes versus herds that don't within the same lines. It probably behoove us, if someone's watching this that does that kind of genetic research, that we start to get on top of that and start lining out some of these signals.
Yep, absolutely.
Well, I sure appreciate you being on the show.
Absolutely. Pleasure to be here.
You do a great job. You do a great job with our students, a great job with our referring veterinarians, and with our faculty. Folks, thank you for watching DocTalk. Remember, always work with your local veterinarian. And if you want to know more about what we do here on DocTalk, you can find us on the web at www.doctalktv.com. Thanks for watching DocTalk today, folks. I'm Dr. Dan Thompson, and I'll see you down the road. Closed caption brought to you by AgriLabs, the perfect pairing of performance and value.
For more information about this program or previous programs, go to DocTalkTV.com. DocTalk was brought to you by Merck Animal Health, the science of healthier animals.